Hi, good afternoon, everyone. Welcome to the Foundation for Opioid Response Efforts webinar this afternoon. We are thrilled to be with you and to introduce and discuss our new request for proposals during this information session. And we will be reviewing today our RFP focused on engaging and empowering vulnerable families and communities to prevent opioid use disorder and overdose. I'm Karen Scott, president of the Foundation for Opioid Response Efforts. Again, welcome to you all. It is terrific to watch everyone log on and to see your interest and to know your interest in the foundation. Just a few of the logistics for this afternoon. As always, our webinar is being recorded and the recording will be available, will be posted on our website shortly after the session ends. We will also make the slides available for download again on our website later this afternoon. Please use the Q&A button found at the bottom of your Zoom screen for asking questions. Please note as well, if you have a question, you see a similar question, you can upvote using the thumbs up button so that we move that question higher up the queue. We are aiming to get to as many questions during this session as we can, and after a brief presentation from myself and our senior program officer, we will move straight into answering your questions. There are a lot of people on this webinar, which is really exciting. It will be hard for us to track questions if they're going into the chat instead of the Q&A, so please use the Q&A. Additionally, we will prepare a Q&A document following the webinar and have that make that available on our website as well to get to questions that we don't get to during this hour. Finally, we will have a brief summary immediately following the webinar. We are always looking for feedback and how we can improve our communications and program processes. So please take a moment and fill out that survey for us. So we can move on, and I would guess that there are many of you who have been on prior Foundation for Opioid Response webinars, but just as a brief introduction to FORE, again, this FORE is a fairly new national grant-making foundation. We were founded in 2018 to focus on supporting solutions to the opioid crisis. The vision of the foundation is to inspire and accelerate action to end the opioid crisis. And we have gone about this work by convening and supporting partners, advancing patient-centered, evidence-based solutions to address the opioid crisis. We focus on having patients very much at the center of all of the projects and programs that we develop and support. And as well, our focus includes projects that address and develop professional education, projects that focus on payer and provider strategies, policy initiatives, as well as public awareness. We can move to the next slide. And the foundation has developed its work really across three complementary activities. The first of which, of course, is our grant making. And to date, we have awarded 44 grants, committing about $13 million since the beginning of March 2020. Those grants fall into our programmatic areas of interest, including access to treatment for opioid use disorder, recovery services, and a series of grants to make sure that we're learning from changes that occurred during the pandemic, during COVID, so that we can strengthen services going forward. This year, we've added 2 additional RFPs to expand our programs further. We recently closed the RFP focusing on innovation challenges, particularly focused on areas of stigma and data and transitioning from treatment to recovery. And the focus of our webinar today is on our newest RFP, which is a focus on prevention and vulnerable families. And as you can gather, we've progressed from a focus from starting with access to treatment. We've done some work on recovery. We're doing some work to look at how we learn from the pandemic and respond in a timely way to those opportunities. But today's really an opportunity for us to start talking with all of you about the ideas and the opportunities to move a little bit further upstream, think about prevention, think about vulnerable families, kids in families that where there's been a parent or other member with opioid use disorder or struggling with substance use disorder, and how we help to support both the next generation as well as the adults in those families. FORE is also an active convener, and we're especially interested in bringing together best practices, those on the front line, with policymakers and decision makers, again, to really strengthen the national response to the opioid crisis. And finally, the foundation has been developing resources, including issue briefs and other documents that help highlight the work of highlight the work of our grantees. And I hope you'll visit our website to view and use some of these resources going forward. But right now, I'm going to introduce and turn this over to our Senior Program Officer, Dr. Ken Schatzkes, who will provide you with some more of the specifics details on this RFP before we open it up to take your questions. Ken?
Great, thanks, Karen. And thank you everyone for joining. It looks like we have a pretty incredible turnout for this, which I think is symbolic of the high interest in this opportunity and our previous RFP as well. So we're just going to jump right in to talk about this new RFP focused on prevention. So let's just move on. So to frame the purpose of the RFP and why we put this request for proposals forward, at the moment, it's estimated that 1 in 8 or 8.7 million children across the US age 17 or younger in the past year resided in a household with at least one parent who had a substance use disorder. We know that the opioid crisis, has led to an increase in children in foster care systems living in poverty. And we know that the COVID pandemic has only exacerbated many of these issues. And growing up under these circumstances can lead to, what we call adverse childhood experiences or adverse events that we know can eventually lead to children being more susceptible to addiction later on in life. So as you see here, you can see that opioid misuse often begins in adolescence in the context of those adverse childhood experiences. And for this reason, we believe there needs to be a large focus on helping children and families that are most vulnerable. And when we say families, we really mean the whole family holistically, recognizing that there may be a parent or a family member that's in recovery or is an active user and may benefit from treatment and recovery services, while there may be other family members such as children who may benefit from more preventative measures. We know that families look very different, in different parts of the country and in different communities. There may be family members that may be separated from their children for a time, and those that live in very low income communities. So it's for these reasons, we really think that there needs to be a comprehensive approach to prevention, looking at it from the holistic entire family, addressing prevention for the child and recovery for the adult, is community-based and culturally informed, and really focuses in on those adverse traumatic experiences that may accompany that substance use and addiction. So through conversations with experts from a range of experts from around the country, we believe there is an opportunity right now to really look at the evidence base, expand it, see what's really working out there, with a focus on highly vulnerable families. And you'll see this as a pattern in everything that we write here, in highly vulnerable, most at risk. Lift up current models that have shown really, really positive outcomes, and figure out how do we begin to take those models and implement them in other communities, and as well as sustain them long-term so that we have the same outcomes in those communities. So with that, to sum up what this funding opportunity is about, is to really improve, expand, or scale evidence-based family, school, and/or community-based prevention services for children and families, again, stressing those at highest risk. So if we get in a little bit more in the details of what types of projects that we're looking for here. Again, looking at evidence-based models, everything we do here has to have an evidence base to them. Evidence-based models of family and community-based prevention for OUD and overdose. Now, when we say family-based prevention or interventions, again, really looking at it from that holistic approach, looking at the needs of every family member, again, recognizing that there may be some that are in treatment, that are in recovery, while others may need more preventative measures. By community-based interventions, sorry, I see my volume is going in and out, so hopefully it stabilizes. Someone on the 4 team, let me know if it still keeps going back and forth. By community-based interventions, here we're really looking for projects that meet children and families that are at high risk where they are. So these can be school-based programs, after-school activities, healthcare settings, and other community-based settings where we be able to reach this population where they are. Now, underneath those, we're looking for projects that are focused in 3 areas. Everything that we do is as just similar to how we did the last RFP. We always kind of like to put things in 3 focus areas, and you can apply for one of these, or it could be cross-cutting as well. So the first focus area is really focused on those adverse childhood experiences that I explained before. We know that ACEs, trauma, play a very large role in whether an individual is susceptible to developing an SUD or an OUD later in life. And we know that people with higher ACE scores are more likely to experience addiction compared to those who did not have childhood trauma. So in this area here, we're really looking, for example, here, evidence-based prevention models that target those high-risk children and families, including families who have a caregiver in treatment, recovery, and/or actively using substances. The second category has a focus on health equity. So we know, again, that in recent years, the gap in opioid overdoses and diagnoses among racial minorities, including Black, Latinx individuals, and compared to white Americans, has narrowed very significantly. And the punitive measures of the quote unquote war on drugs has also led to, in these communities, a disproportionate number of children to grow up without a parent present, which is an ACE in itself. So, and even with this context, there still is, it's very limited, the number of effective interventions that are present in these communities. So for projects in this area, we're looking for projects that are looking to develop culturally informed, inclusive prevention models that really focus on those health inequities, are effective in these diverse communities, and really looking at ways of not only implementing them, but identifying those routes to sustain them the long term so that we can help those communities for the long term. The last category is a little bit different. It's focused on pain, and specifically pain, emotional distress, and trauma. We know that that emotional pain and physical pain is still a common reason for initiating misuse of opioids and other substances in the first place. So what we are looking for in this category are projects that can help children and adolescents develop healthier ways of responding to that emotional pain that often comes along with that, with ACEs and trauma. And with interventions and supports that can be based in a variety of community settings. So again, schools, homes, and other community settings that you believe would be great places to meet those vulnerable children and families where they are. Move on to the next slide here. So again, as Karen explained, at FORE, everything that we do is patient-centered and has a focus, and everything that we do has as a lens on health equity. So this RFP is no different, and we expect the projects that we would fund in this are also going to have components of this. We also assess projects within the framework of our 4 focus areas of the foundation, which we believe are important to address, to fully address the opioid crisis. Again, as Karen stated, professional education, payer and provider strategies, policy initiatives, and public awareness. And in your application, you'll kind of tick off which one you think it belongs, or which category your project belongs in. Now, the award, this is actually the largest award that, potential award that we've had in an RFP so far. So we are happy to award up to $500,000 a year for up to 3 years, with the understanding that prevention, it takes a little bit longer to get that data and evidence needed to show those outcomes, that things are working or whether they're not working. With that being said, I want to stress, as you fill out your concept notes, to be really thoughtful about what you're proposing as your budget. The budget must match up with the project and the scope of work being proposed. So, and that will be taken into account because we're going to be awarding, a number of different projects of different award amounts and a number of different years. So again, I couldn't stress this enough to really be thoughtful in the way that you present your concept note and to match up. Again, it doesn't have to be an exact number at the concept note stage, but to be thoughtful about it as you present it. The RFP has been open now for about a month, a little bit less than a month, and it will be continued to be open until September 20th. And we can dive into a little bit more of the specifics of the timeline in a few slides. In terms of eligibility, again, this is generally how we consider grants for any of our programs. We consider grant requests from US-based public charities, organizations, tax-exempt institutions of higher educations, state, local, city, and tribal governments. So basically, we fund everything that foundations fund. And as we went through the innovation RFP, and again, really anticipating the high interest in this RFP as well, we would prefer a limit of 1 concept note per organization. Or if you are an academic center, a hospital, or a government agency, then I would say we would limit 1 per department over there. That's a preference. We're open to having a conversation if there is, but we would ask you to be very thoughtful in the way that you present that concept note. If it's coming from 1 single organization, how you may be able to work together within that organization for one holistic project. So as you fill out your applications, just think that through a little bit. Now, key dates for this. So again, July 20th is when we open this up, and we will be closing closing concept note submissions on September 20th at 11:59 p.m. Eastern. That being said, we would highly recommend you get your concept note in before September 20th, as we don't want to have any technical issues in terms of getting your concept note in. We want to make sure that there's plenty of time for us to handle any technical issues that may come up. It will also allow us to start reading some of those concept notes earlier on as well. So, September 20th is the drop dead date. The latest notification, how we have our process here, is that you would submit a concept note. Our program staff here, and we would consult with experts if needed, would then review all the concept notes submitted and invite a number of them to submit a full proposal. The latest notification for a request for a full proposal as of now is October 8th. That's subject to change depending on the workload that we have. The earliest notification of final decisions for awards is going to be at the end of February. And again, that is subject to change as well. You can find out more information about how we do our grants and funding, as well as more information on this specific RFP at the website below. We will make these slides available, as well as a recording at the end of the session. It'll be on our website in our resources section. So you can go back and find all the links there, or just navigate our website, and I'm sure you can find a lot of the information that you're looking for. Finally, just, in this case here, with, again, the high number, high interest in this, we'd ask you if you have any general questions, eligibility inquiries, or anything as you fill out your application, to submit it to this email address, info@forefdn.org, and there we'd then be able to route it to the correct person and get you the correct answer that you're looking for. With that, we will now open it up to the questions and answer session. Karen, I think I heard her jump back on.
I am back on, yeah. And thanks, everyone. So we've got 40 questions already in the queue.
Already.
So we will we'll kind of do a rapid fire and get through as many as we can. So Ken, I'm happy to start off on the first question here. Do we choose one focus area, or if our project possibly covers more than one, can we select those that apply? Absolutely. You can select more than one. But we absolutely at least want you to select one. That really allows both. It allows us to get a sense of where the work is being focused, but I think it also helps you, as you're drafting your ideas and your concept note, to again make sure that that you are meeting the description of at least one of these three areas. But again, at least one of these three. If it overlaps, that's all the better.
I do see in the Q&A box, we have 55 questions. I see a couple repeats. So again, we just ask you to look through some of the questions and use that upvote button to make sure that we're getting to the questions that the most people have, so that we're not just going down a list of one-offs. So the next question is looking at, how do you look upon organizations looking for funds that work in partnership with other organizations? That is always a strength of applications. If you are able to show that you have multiple partners working, especially when this is a community-based prevention, that will be looked upon favorably, definitely.
Yep. Can you apply for two similar but slightly different school-based prevention programs in the same application, one with a mental health component, the other not? Again, I would say that is likely to fit the RFP. Again, make sure that the project fits at least one of the three target areas that are on the screen. And also, as a reminder, Ken's comments about we really strongly prefer that if an application is coming from a specific organization or from a PI or a department of a large organization like a university, that that you limit it to one concept note that fully covers the project. Ken?
Next, would you share the experts organizations you worked with to develop this request? So you can actually go onto our website and look at our, we do a lot of work with our scientific advisory council as well as our board. You can find out information about them on our website in the About Us section and read a little bit about their expertise there. But they were heavily involved in working this RFP together, as well as another program advisory meeting that we had on prevention a few months back. Which I believe we will be, we'll get up an executive summary soon, which will list out the experts that were there as well. So there should be some information on our website already about that.
Yeah.
Great.
Is it acceptable to change PIs between submission of the concept outline and the full proposal if both PIs are with the same institution? Part of our initial review and assessment of the concept notes certainly includes assessing who would be carrying out the work and the experience and expertise of that person. So unless it's a highly unusual situation, which you could then write to explain to us, we really would expect that the PI that's listed on the concept note is the person who would be leading the work.
Definitely. The RFP refers to evaluation. How rigorous do you expect the evaluation to be? I think that depends on the project. And I do think, again, everything we do here at FORE is about building evidence. It's evidence-based. Every project that we fund, or the majority of projects that we fund, do have an evaluation component because we want to make sure that what we are funding is, we're finding out if it's working or it's not. So I would expect for a project of this size, of this kind of funding, we would expect a pretty rigorous evaluation for us to determine whether this is a model that could be expanded out eventually. So, yeah.
Okay, I noticed that 2 of the 3 categories specifically state children as the target demographic. Will projects that target youth and adults 18 and over be disqualified? Again, this project does have a heavy focus on children and families. So youth would meet that criteria. A project that's solely focused on adults, less likely to meet the goals of this program.
Just pressing that one. What type of outcome measures are you hoping the projects to show in the project period? Some we may not see for many years with regard to prevention. Yeah, that is a valid point. I think, again, it's going to be very dependent on what the project is proposing and what the focus of it is on. Our reviewers will be looking at whatever outcome measures you're proposing and whether it matches up to the project that is being proposed. So that's, I think, the best guidance that we can give, but we do acknowledge that some, we may not see, definitively for many years when it comes to prevention. So I think it's going to be important to become some surrogate measures for the time period of making sure, are we going in the right direction?
Right. Okay, one of the slides says FORE prioritizes work which incorporates focus on patient-centered solutions. Just to clarify, is this restricted to healthcare related projects, or can it be strictly community-based, not involving healthcare? It can be community-based. So that's a good catch in terms of on the language of use, but we are not restricting this to only healthcare based projects. Community-based organizations definitely welcome as well.
Yeah. The next one is an important one because I think we get this one often. So regarding the 3 identified focus area, if the project addresses all 3, how should we document this in the grant portal when submitting the concept note? We'll be allowed to select multiple focus areas. So first, no, do not submit multiple concept notes to the same project. I would say I would pick one of the identified focus areas that you think is the strongest one that it's aligned with and go with that one. When we do our review, we look at it, we kind of almost do a reset and look at it. What does it fit into? So I wouldn't worry too much about getting that, exactly if it's across different focus areas. I would put, the one that you believe it fits the best.
Okay, questions are coming around. Can you estimate how many concept notes will be moved to the full application? How many awards will be made? That's really hard for us to do at this point. Except, again, each one of our RFPs so far has had a tremendous response in terms of the number of concept notes that we've received. But until we have a better handle on what's coming in, it'd be premature to start to put numbers on it. The one thing I can say is that just to look at our first couple of RFPs from last year, each one of those yielded between 10 and 20 grant awards. So that's somewhere in there is likely to be where the numbers will fall out for this program. But again, it will also depend on the actual amount requested in the proposals.
Right, top. Would you look favorably on evidence-based programs that are seeking funding for sustainability? Yes, definitely. I think, we view ourselves, for itself, compared to the federal government and other, larger funding agencies, we have limited funding. We really see ourselves as being able to pilot new ideas get the evidence and show that it works, and then help you find the funding for sustainability down the line as well. So if you can have that as a component in your application, I think it would only strengthen it.
Right. The other thing I would add to that, though, is also to think about if you have a program where there's some good evidence to work, we would be really interested in, is there an opportunity to also spread that work perhaps to a different community, different population, different part of your community, or different part of the state, or part of the country. So we'd be interested, say, in the spread as well as helping you think about sustainability. Can you define evidence-based? Does a program need to be externally evaluated to be considered evidence-based, or a program with its own evaluation mechanism considered evidence-based? Certainly, we will evaluate the strength of the data that you have. So if what you have is internal data, we are open to reviewing it and assessing, again, the strength of that of the data that you have, and what the next steps might be for you.
Mm-hmm. Are you looking to fund projects that are using existing evidence-based interventions, or you're looking for promising practices that are seeking to determine efficacy? I would say both. I think I would say both. I think the important thing here is that we're trying to find, those models that are working and that can be expanded and implemented at different places. So whether that's an existing evidence base or you're looking at something that you need to do more evaluation, I think we'd be interested in either.
Okay. Is it required that children and families participating in proposed interventions have a history of SUD or OUD in the family? So in consultation with our advisors, we did make the decision to start this program with a focus on families at high vulnerability, families at high risk. And we are defining that for purposes of our work in the foundation as families where there is an SUD, OUD problem in the family, and we'll be particularly interested in interventions that, again, both may help support the person, a person who's in treatment and recovery, as well as help mitigate the impact and help prevent opioid use disorder in the children.
Yeah. So at the top, would a comprehensive family support group model for families affected by addiction that includes education and self-care be considered? The goal would be to help families become more healthy, including children. I believe that would fit the RFP and what we're looking for. Mm-hmm. So it would be considered, definitely. Yeah.
Yeah. Yeah. I'll just comment, I see in the chat that some people were still not seeing the upvoting, but we are getting a number of questions that have been upvoted. I'm gonna just ask Kat or the FORE team, maybe if she's able to provide any guidance in the chat to those who are not seeing that ability. Describe more fully what payer and provider strategies means. So as we think about the spread and sustainability aspects of projects that we're funding, we are certainly interested in what the long-term strategies can be for supporting that work, and often that means thinking about how some programs might get incorporated into ongoing services and delivery systems, whether it's in mental health delivery systems, healthcare providers, hospital systems, for example, or other community service providers. Payer strategies that can include how insurance companies may pay for this, for these services in the long run, as well as use of other federal and public funds.
Mm-hmm. Yeah. Can a portion of funds be used as incentives for client-patient long-term follow-up? I think in the context of the correct project, I believe so. I think it's going to be very project dependent as to whether that would be included. Yeah.
All right. Does the foundation support direct services projects? So we are supporting projects that help develop models, test models that that ultimately can be spread, can be sustained, incorporated into services for the long term. Generally, we do find that proposals for direct services are fairly limited, and in terms of scalability, and don't quite fit the programmatic goals of the foundation.
All right. I'm going to answer questions. I see two questions here that are kind of connected, so I'm just going to answer both of them, which is a template for the concept note first. All concept notes are to be submitted through our grants management system. Within there, the template is there. It's a form that you have to submit. There's no adjustments you can make to it. There's no Word documents or anything. It's questions and answers. So you have to submit it through there. You know, that's the easiest thing that we can do. In terms of the RFP budget as written, it's written as $500,000 per year for up to 3 years. In the concept note, should the proposal be written, you know, as 1.5 million over 3 years, or should each year be requested separately? Within the concept note, the language is going to be pretty clear. It says to ask for the total amount that you're requesting, total over the entire grant period, and it also asks you the number of months. So I would make sure that you follow instructions, as that helps us, you know, be able to evaluate these proposals much more quicker. We don't have to correct the numbers.
Okay. Is there, do you welcome cultural healing methods such as Hmong shaman, and can we collect data to prove the effectiveness? Again, I would, you know, refer you back to we are looking to support innovative, creative projects and programs. We certainly have an interest in cultural competency, in how to reach different racial and cultural minorities, and address health equity. If you have, and at the same time, are looking for the strongest programs in terms of having the potential to be effective. If you have a program that fits those requirements, we'd certainly be interested in seeing it.
Is there a preference for local, so therefore community level, regional, and national projects? They can fit into all of them. I think the important thing is that it has to fit into, as you can see on the screen here, what we're targeting here in terms of the projects. I think that any of those levels would work fine. I have a feeling that we're going to see a lot more local projects for this RFP, being that we're really looking at those community-based prevention models.
All right, these two questions able to share. I assume by that you mean questions that would be that we would request as part of the full proposal. They're not available yet, but just to say generally, you know, we try to keep the proposals to about 8 to 10 pages. So they're not super long or burdensome. And for the most part, we'd really be looking to have you flesh out in much more detail what you propose in the concept note.
And if you go on our website to our apply for a grant page, you'll see some of the documents and then other information that we always request to be able to do our due diligence on projects and organizations. So there's a little bit of information on there as well. What date would the full proposal be due? And the questions. So the proposal, when we invite those organizations to submit full proposals, they will have 4 weeks from that time period to submit those full proposals. And they'll have all the questions requirements will be shared on that invite. Again, the full proposal stage, all the things that we do, concept, middle proposal, will all be done in our grants management system. So it's all laid out really, really clearly.
Are you offering programs that focus on families that have been affected by bereavement following an opioid overdose death? I would say yes. Again, I would refer you back to the slide that's on the screen. think through. Certainly, I could imagine that fitting within mitigating an adverse childhood experience, but use that as your guide.
Yeah. I think that the next question is a similar answer, in terms of, can a proposal include education training for systems around impact of SUD or ED on children and families? Yes, I think that would fit really, that would fit well in an RFP. So I wouldn't see a problem with that.
Yep. Next question, within queer, trans, non-binary communities, youth, young adults are often raised, reside with gay mothers, fathers, etc., are deeply impacted, sometimes positively, sometimes negatively by these relationships in the absence of bonds with families of origin due to non-acceptance. Yes, I know this began with an earlier question, but yes, we would certainly be interested in projects that focus on these families.
Definitely. Would a youth-only program qualify? Yeah, again, I think it just depends on the project itself, but I don't see why that would be an issue.
Okay, equipment and telehealth expenses are generally allowable. Again, the guidance there would be along with the budget to, as long as it, are items that are clearly fit with the goals, and the requirements for carrying out the proposed project.
Yeah. Is it required that adults have a history of opioid use and OUD, or is broader SUD and polysubstance use acceptable? I think, as Karen said before, as a foundation, our mandate is to focus on the opioid crisis. So there would need to be a component of opioid use in addressing opioid use or OUD in the proposal. That being said, we do fully appreciate that we fully cannot address the opioid crisis without addressing polysubstance use as well. So hopefully that's enough guidance to help with putting a proposal together.
Yeah. Expand on the limitation on direct services. For example, would a proposal for a mental health clinic to expand attachment-based treatment for children in school and community-based settings fit? So again, if the proposal is to test a model of delivering a particular service and evaluate the impact of those services or that model of delivering services, then within a context such as that, the direct services would be a fit. If the proposal is solely focused on paying for individuals to receive a service, we don't feel that that's the best use of a foundation grant versus services. If they're services that could be paid for by other public programs, by mental health services, block grants, Medicaid, etc.
All right, and I'll answer two here, because I think that one of them will adding personnel salaries that allow new services to community adolescents with co-occurring illnesses and families with OUD and acceptable use of grant funding. I think it's similar to Karen's answer before. Now, a big part of this project is really looking at sustainability as well. So, if the project does require some new services, personnel, we do cover salaries, but we would really, want to see a sustainability plan in place to show, once the grant funding's gone, how would you support that personnel and new services that you put into that community at that point? And that's important. And then the top question here, the notice of awards is by 2/28. What would the grant period itself be? That is going to be dependent on each individual project, when we're able to award them. So it's a number of there's a number of things that go into it. So but that we can deal with once we get to full proposal stage.
Yep. Yeah. Okay. What's the relationship between FORE and McKesson? There's not a relationship between the foundation and McKesson. In 2018, McKesson provided a one-time amount of funding that that helped set up the foundation. But since that point, everything about overseeing those funds, making decisions about grants, investing the funds so that there is a money available to make grants is under the governance and leadership of the foundation. And my executives as well as the board. Okay, what % of the budget should the evaluation of project be? We do not have strict funding. I know many particularly government agencies have demarcations about how much of a budget for each aspect of the project. We do not. We're really looking for your for your thinking on what's needed to carry out the work.
So top here, the evidence-based program we were considering is evidence-based proven for preventing teen pregnancy and preventing dropout, but not preventing SUD or OUD. But we do think it would work well for that as well. Would that be okay? I think you would need to make the case and show the connection and link that something that correlates that kind of model can then be moved over to substance use disorder. So I think that'd be on the applicant to make the case if it's possible.
Okay.
Yep.
Can the projects include funding for harm reduction materials? Again, we would have to see it in the context of the full concept note too. So we wouldn't entirely rule it out, but we'd really have to see it in the context of the full concept note.
Yeah, I think the next question here, harm reduction education, focus on overdose prevention via vending machines and in-person trainings and collaboration with community partners, folks. Again, I think that would fit the RFP. On this, again, I think it just, again, depends on what the project's being proposed and what, and the funding amount and the amount of years. So I think we just have to see a proposal, whether it would fit.
Okay. When you say prevention for OUD, would efforts to help the successful cessation of prescribed opioids prior to an SUD diagnosis qualify? So I would say that, again, look at the way we describe the third item in terms of the three target areas, but efforts again to help kids, adolescents develop healthier ways of dealing with pain, alternatives to, certainly that's a focus on, what the alternatives to medications, prescription medications, and other drugs are.
Great. So I'll just answer the next two. Would smaller nonprofits like Boys and Girls Club be considered for this grant? Of course. Yeah, we award to, organizations of all different types of sizes. It's basically based on the merit of the project. And does this funding cover administrative oversight? When you get to the full proposal stage and you fill out a detailed budget, we do have space in there for fringe benefits as well as indirect costs. We provide up to 10% indirect on direct costs under our grants.
To clarify, if the community school-based category must include a family intervention component in addition to the child adolescent intervention component, it does not have to. Although I would say, I would encourage everyone to be as creative and holistic and comprehensive in the way you think about the projects you propose.
Is a match a requirement for this grant? No, it isn't, but we are always open to additional funding that can always strengthen a project. So if you do have anything in mind, I would put that in the concept note for sure.
Yeah, great. Okay, we are looking to expand our current SUD treatment model to a new location in late 2022. Should we apply for this cycle to help with the startup costs? Or do costs and projects need to start in March 2022? So again, I would first go back to the criteria and the focus of this proposal. I'm not sure that if it's general support for starting up or building a new clinic or service, that is not something that we're going to consider as part of this proposal, as part of this RFP.
Okay, so I'll take the next two because I think they are related again. With looking at outcomes like reduced stress, isolation, depression as root causes of addiction be enough of a link for prevention? I think it depends on the project, and I think it depends on what you are looking to achieve in that project and whether those outcome measures are appropriate. So it's hard for me to make an assessment on that. But those are three things that we know are, linked, to addiction. So I wouldn't see why not, but it's hard to say without seeing what the project actually is. The second one here, the last focused area targets responding to trauma and pain. Can you clarify if this must be related to trauma from SUD or can this be trauma in general? So I think what we're trying to really focus on here is trauma that occurs that may lead to an SUD. So I think that it's that area, not necessarily trauma from the SUD per se, even though there may be that as well, a component of that as well.
Sure. Yep, many universities have a higher indirect than 10%. We acknowledge that, but our 10% is in line with other private foundations around the country. We have funded many universities. Again, please take a look at our website. Under our grantees section, you'll get an idea of the breadth and significant number of universities around the country that we're funding. I'm going to do the next one. So I had a chance to read it. Just to clarify my understanding, the proposal can be based on evidence-based models or proposed to develop one based on data. Yes, that's correct.
Yeah. The next one, can we focus on tweens rather than kids of all ages? And for mitigating AIDS, can we focus on just the kids or does the program need to include parents? Again, yes, it can just focus on kids, but we are encouraging, and a big part of this RFP is the understanding that we need to come at prevention from a holistic point of view from the whole family, that it's not just, we're not going to get out of this crisis without dealing with the whole family, as opposed to just focusing on kids in a silo versus parents in another silo. We need to be thinking about this holistically. So while it may fit, I would think about that as you fill out your proposal.
Okay.
It's a question on the direct services again.
So the direct services again. If the proposal is purely to receive reimbursement for one-on-one direct services, that's not the idea of this RFP. If the proposal requires, if doing the project requires including funding for services during the course of the project, then that would be something, that yes, we would consider. If it's a youth-only program, would it have to have a direct link to a family member with OUD?
And I think this next question after that is a similar one.
Yeah.
So I think it's the same answer as I gave before. Again, it can be a focus on one specific population, but when you read the entire RFP and you look at how we're looking at prevention, it will be looked on very favorably if you come at this from a holistic point of view of the entire family.
Yeah. Right. Let's see.
Telehealth.
Shifting. So can the budget be used to enhance telehealth technology? I think that's within the sorts of activities that we would consider. Yes. Again, as long as it ties to one of the target program areas and the overall objectives of the RFP. Can the project be based on a national level where it would benefit numerous communities in different states? Sure, that'd be great.
All right, so I'm just going to move to the next one here. This looks like a funding announcement for a scientific study, not a funding announcement that supports services or bricks and mortar. Science is not really our most urgent need here in the trenches. We need financial support to keep the safety net of services people need. I do know that we never have received an award despite applying several times. So for this RFP specifically, we are, again, every RFP that we develop, every funding opportunity we develop is for a specific purpose. And in this one here, we're looking at prevention models that are out there. And I don't know if this is completely a scientific study, because what we're trying to do is get new programs, figure out which models can then move into these communities to provide those services and have those long-term effects. We agree that there's a really, really big need right now for financial support for service, especially recovery services right now, with COVID, with opioid overdoses at records high. You know, and you know, there are other funding streams available for those services. However, you know, the way that our foundation and our funding opportunities right now are set up is we're trying to increase that evidence base and help people figure out what works, who it works for, where does it work, and then hopefully people with like the government can, with larger dollars, can come in, provide that funding to really provide those services, as you say, that are really, really needed.
Okay, I'll take the next couple. In New York, oops, just moved. New York State, there's a recent push to establish an OASIS certified peer position, certified peer recovery advocate - family, an effort that involves getting family members trained, certified, dispatched into communities and appropriate submission. Again, that sounds very much like that would be in line with the criteria and with the areas that we're focusing on in this RFP. Again, we'll just keep referring people back to, but the guidance of read the RFP very closely and specifically to make sure there's a fit. The program participants be both children.
We got time for maybe 2 more questions.
Be both children and families, the OUD history, and children and families experiencing health inequities, but no history. Yes, it's about prevention. So if the project and the program is to work in ways that we know are effective in preventing, or to test a new way of helping kids stay healthy, that would be a fit.
Yeah. Great. So I think we're at 3 o'clock actually. So
Okay.
I think we can close it up. Want to do one more? Go for it.
One more? Okay.
Okay, go for it. One more.
Okay, how would the public awareness work if we can only focus on families that have been impacted, but would be to the general public? So, not every one of those areas is going to be a fit for every project and proposal, or even every program. Some of our programs, such as access to treatment, has focused more heavily on on providers and provider strategies and professional education. So you don't need to try to meet or make the project fit all of all 4 of those areas. Some people may have a focus on being able to do broad education or communication in some unique, creative ways to reach families, and that may include that might fit within the public awareness piece. But again, you should not have to try to make your project fit every single one of those 4 Ps framework.
Yeah, exactly. So
we are, now just getting past 3 o'clock, I would say, as Ken had put up, we do have an info@forefdn.org email. We will do our best. If you follow up, if we didn't get to your questions, we will do our best to try to respond if you ask them through the info at FORE email. We will also do an updated Q&A document summarizing some of the most frequently asked questions this afternoon. Ken?
Yep, and stay tuned on our website for recording and other resources around this. Again, highly encourage people, if you're going to be applying, to submit your concept note before September 20th. But again, if you have any questions, please reach out to us at info@forefdn.org. And thank you everyone for joining us today.
Yeah, thank you so much for your interest and for the work you're doing. Thank you.
Thank you. Have a great day, everyone.